This week, we're going to talk about nutrition diagnosis. We already had an introduction to that in last week's class. It's important to note that we do nutrition diagnosis in part so that the dietitian really has something that is his or her area that they're responsible for. And so the nutrition care process leads us to making a nutrition diagnosis, but that nutrition diagnosis should be something that the dietitian, himself or herself, can independently that means with the help of the client, can help the client improve or resolve. Now, we've already talked about the steps leading up to nutrition diagnosis. We've spent weeks now talking about nutrition assessment and the many ways in which we do a nutrition assessment in order to help us find the nutrition problem, make a nutrition diagnosis, and then ultimately intervene with the client or on their behalf. When we talk about nutrition diagnosis, the main nutrition diagnoses or problems belong to one of three main domains or categories. And those are intake. So if the patient's eating a diet, what are they eating? Or if they're on a tube feeding, what are they getting through the tube? Or if they're on an IV, what are they getting through the IV? The second would be clinical. So for example, are they overweight or obese? If they're a child, are they growing adequately? Other clinical outcomes might relate to whether the GI tract is working well or whether the patient's swallowing or chewing well. And then the last domain is behavioral or environmental. And so that might relate to food security or disordered eating or things like that. Within the nutrition diagnosis statement, also known as a PES statement for problem, etiology, and signs and symptoms, we are literally looking at those three components. What is the main nutrition problem? What is the etiology or root cause of that problem? And finally, what are the signs and symptoms that that problem exists? And the extent of the size of the problem. And then finally, it's important when we're finding that nutrition problem that we're looking for a problem that the dietitian can actually help resolve or improve. With the etiology, that we're also looking at an etiology that is the root cause and also one that the dietitian can help resolve or improve. Or if that's not possible, at least the dietitian can help resolve or improve the signs and symptoms. Those are the key points to consider, and we'll talk more in class.